What you can see, please, if a sacral plexus here, lumbar plexus you show on this chart. Lumbar plexus, you remember here, branches, first 10. Iliohypogastric nerve. You see it goes between internal obliquous muscle, transverse abdominis, and obliquus internus muscle. Yes, and innervates these two muscles. Next 11, ilioinguinal nerve. Before inguinal canal, it innervates all muscles of the abdomen. Please draw a wet cap. After inguinal canal, it innervates skin of the external genital organs. Yes? Ilioinguinal nerve, before inguinal canal, all muscles of the abdomen. After, when ilioinguinal nerve leaves inguinal canal through the superficial inguinal ring, it innervates skin of the external genital organs. Next, lateral cutaneous nerve of the thigh. Please, very good, you can see this nerve. It perforates anterior wall of the abdomen opposite anterior superior iliac spine and innervates skin of the lateral side of the thigh. Next, femoral nerve. Femoral nerve goes through the muscular lacuna muscularum and the inguinal ligament, and in the region of the thigh, it gives following branches. Very good, you can see femoral nerve after lacuna muscularum. It gives muscular branches to muscles of the anterior group. It gives anterior cutaneous branches to skin of the anterior side. A long branch, very good, you can see saphenous nerve. It goes to adductor canal, next leaves adductor canal because it perforates fascia lata. Next it goes along medial side of the leg, along medial border of the foot. Saphenous nerve innervates skin in the region of the knee joint, skin of the medial side of the leg, and skin of the medial border of the foot. Please, very good, you can see saphenous nerve. Next, obturator nerve. Obturator nerve goes to obturator canal and innervates muscles of the medial group. Please, obturator nerve, muscles of the medial group, skin and capsule of the hip joint. And last branch, genitofemoral nerve. Genitofemoral nerve 16 gives two branches. Genital, which perforates posterior wall of the inguinal canal and innervates coat of the spermatic cord, cremaster muscle. And femoral branch goes to skin below inguinal ligament. That's all. You understand. Lumbar plexus, iliohypogastric nerve, ilioinguinal nerve, lateral cutaneous nerve of the thigh, femoral nerve, genitofemoral nerve, and obturator nerve. And muscular branches, you cannot show. Short muscular branches to iliopsoas muscle of the pelvic girdle. Sacral plexus. Sacral plexus, you remember, emerge branches from suprapiriform foramen and infrapiriform foramen. Here suprapiriform, here infrapiriform. Here piriformis muscle, suprapiriform foramen, infra. Superior gluteal nerve, very good, you can see. It innervates gluteus medius and minimus muscles of the pelvic girdle. Next, inferior gluteal nerve. It emerges from infrapiriform. Next, nerves emerge from infrapiriform foramen. Inferior gluteal nerve, gluteus maximus muscle. Posterior cutaneous nerve of the thigh, skin of the posterior side. Pudendal nerve. It leaves gluteal region through the less sciatic foramen and goes back to pelvic cavity to region of perineum and innervates all muscles of the perineum and skin of the perineum and external genital organs. Please, pudendal nerve. First it leaves pelvic cavity through the infrapiriform foramen. Next goes back to pelvic cavity through the less sciatic foramen. Next, last, sciatic nerve. Sciatic nerve innervates muscles of the posterior group of the thigh. Next, sciatic nerve, very good, you can see here. Sciatic nerve in the region of the popliteal fossa divides into two branches, common peroneal nerve and tibial nerve. Common peroneal nerve goes to superior muscular peroneal canal near head of the fibula and divides into two branches, superficial peroneal nerve and deep. Superficial innervates muscles of the lateral group of the leg, next continues on dorsal surface of the foot, and here innervates skin, except medial border, because here saphenous nerve, lateral border, because here sural nerve, and lateral side of the first and medial side of the second, because here deep peroneal nerve. That's all. Deep peroneal nerve innervates muscles of the anterior group of the leg. Next it goes to dorsal surface of the foot. Here it innervates extensor digitorum brevis muscle, skin of the lateral side of the first toe, and skin of the medial side of the second toe. That's all. Next, common peroneal nerve. Here tibial nerve. Tibial nerve goes to cruropopliteal canal between soleus muscle and posterior tibialis muscle, this canal. And along canal, it gives many muscular branches to muscles of the posterior group of the leg. Next, it goes to plantar surface of the foot, and here it gives two branches, medial plantar nerve and lateral. They innervate muscles of the plantar surface of the foot and skin of the plantar surface of the foot. Next, that's all about innervation of the lower limb. Next, vessels of the lower limb. Please, very good, you can see here and here, vessels of the lower limb, very good, you can see. External iliac artery is a branch of the common iliac artery. In this case, right common carotid, right common iliac artery divides into two, external and internal. External continues as the femoral after lacuna vassorum. Femoral continues as the popliteal. Popliteal gives two terminal branches, anterior tibialis artery and posterior tibialis artery. External iliac artery gives two branches. Deep circumflex iliac artery to muscles of the anterior group of the pelvic girdle, and inferior epigastric artery which goes to muscles of the abdomen because ascends in anterior wall to region of the umbilicus. Femoral artery gives 6 branches. Superficial circumflex iliac artery first, superficial epigastric artery to muscles of the abdomen second, external pudendal arteries to external genital organs third, deep femoral artery fourth, muscular branches to muscles of the anterior group of the thigh fifth, and descending genicular artery along adductor canal 6. You understand? Next, deep femoral artery gives branches which vascularize all muscles of the lateral circumflex femoral artery, muscles of the anterior group and capsule of hip joint. Medial circumflex femoral artery, muscles of the medial group and capsule of the hip joint. And many perforating, 3 or 4 perforating branches to muscles of the posterior group of the thigh. Next, femoral artery goes to adductor canal. Along adductor canal gives descending genicular artery which takes part in the formation arch of the knee joint. And next goes to popliteal fossa. Here it changes name, called the popliteal artery, gives 5 branches to knee joint. What 5? Superior medial genicular artery, superior lateral genicular artery, middle genicular artery, inferior medial genicular artery, inferior lateral. All these 5 arteries, together with descending genicular artery and together with anterior and posterior recurrent branches from anterior tibialis, form 8 arteries, form arch of the knee joint. After that, popliteal artery gives 2 terminal branches, anterior tibialis artery and posterior. Anterior tibialis artery goes between the anterior tibialis muscle and extensor hallucis longus muscle, and gives recurrent branches to knee joint, muscular branches to muscles of the anterior group of the leg, malleolar branches to talocrural joint, and next it continues as the dorsal artery of the foot. Dorsal artery of the foot gives branches, medial tarsal artery, lateral arcuate artery, you not see because deposition, arcuate artery. 4 dorsal metatarsal arteries arise from arcuate artery. They continue as the common digital arteries. Each common gives 2 proper digital arteries. All these branches of the dorsal artery of the foot vascularize extensor digitorum brevis muscle and all joints of the foot. Posterior tibialis artery. It gives many muscular branches to muscles of the posterior group of the leg. Also, it gives peroneal artery, which goes to inferior muscular peroneal canal and vascularizes muscles of the lateral group. And posterior tibialis artery in the region of the talocrural joint also gives malleolar branches, same malleolar branches of the anterior tibialis artery. They anastomose and form on lateral malleolar arch, on medial malleolar arch. They vascularize talocrural joint. Next, posterior tibialis artery surrounds medial malleolus and goes to plantar surface of the foot, and here it gives medial plantar artery and lateral. They anastomose and form plantar arch. 4 metatarsal plantar arteries arise from plantar arch. They continue as the common digital. Common give 2 proper digital arteries. Each common, 2 proper. That's all about arteries. Veins. If veins, you understand, veins, same arteries. Veins, same arteries. Only on the leg, near each artery, you can see 2 veins. Next, only 1 vein. 2 anterior tibialis vein, 2 posterior unite and form only 1 popliteal vein. Popliteal vein continues as the femoral vein. Femoral vein continues as the external iliac. External iliac joins with internal iliac, forming common iliac vein, right and left. Common iliac veins unite and form inferior vena cava. Superficial veins, number 2. You remember, very important for lower limb, great saphenous vein. It goes along medial side of the foot, medial side of the leg, medial side of the thigh, overlaps inferior horn of falciform margin, and very good, you can see it drains to femoral vein. Please, very good, you can see great saphenous vein drains 2 centimeters below from inguinal ligament in the region of the saphenous hiatus. Here, fasciolata doesn't present, and femoral vein, great saphenous vein drains to femoral vein. Please, very good, you can see. Second superficial vein, lesser saphenous, it goes between bellies of the gastrocnemius muscle and drains to popliteal vein. There are 2 superficial veins on lower limb. Great saphenous vein, very important, and lesser saphenous vein along posterior side of the leg, it drains to popliteal vein. That's all about venous vessels of the lower limb. Venous blood from lower limb flows to inferior vena cava. Because femoral vein continues as the external iliac, external joins with internal iliac in pelvic cavity. Next, you see 2 common iliac veins in the region of the sacroiliac joints. Common iliac veins, roots of the inferior vena cava. That is why venous blood from all structures of the lower limb flows to inferior vena cava. That's all about arteries and veins of the lower limb.